Hey guys, so today I thought I'd give you my 2-week post-op update. I'm a little over 2 weeks now, but I just had my 2-week appointment yesterday in Regina. As you guys probably just saw in the beginning clip of this video, some of the nasty weather we had to drive through to get there. So since I've been home, the pain, I didn't have much pain to begin with. They sent me home with some painkillers. I was using them basically at nighttime for in case I rolled over onto my right side, which was the side that had quite a bit of bruising, just in case I did anything during the night that would make it a little bit sore. Since my 5-day post-op video, I've pretty much stopped taking those. I can sleep fine at night generally. Sometimes I wake up in the middle of the night, but I think it's just because throughout the day I'm not super active yet, so just sometimes sitting all day and then laying in bed you just get uncomfortable and you wake up. But both my left and right side are healing very well. All the incisions look basically like minor scratches now. I mean, you couldn't tell, sometimes some of them you couldn't even tell are there, except for the fact that the strips that they used to cover them, the adhesive left the gunk, it gets like a grayish black dirty gunk left on either side of the incision that takes a really long time to wash off. But yeah, they're all healing really well. The surgeon yesterday said yeah, everything looked really good. The bruising is just about completely healed up. Incisions are also looking really good. The one incision where they pulled out my stomach is going to leave a little bit of a bigger scar than the rest. It just looks like when they had to seal that one up, they had to pull a little bit more skin together to kind of seal it up, so it's a little more wrinkled and bulging there, but still very, very small. Maybe only half an inch or a quarter of an inch wide, so pretty happy with that. So basically, just been sitting around the house, tried walking a little bit. But last Friday I kind of got my first complication, and it was gout in my foot. And for those of you who don't know what gout is, it's basically you have high uric acid in your bloodstream, which is a byproduct of different types of foods, specifically protein. It can be from wheat and like beer, and when it builds up in your blood, and it gets to your extremities of your body, so like your hands or feet, where it's a little bit colder, it can crystallize in your joints and basically causes like stabbing pains. This can be very painful. So Friday morning I woke up and my ankle was very sore, and I thought, well, this is weird. And I didn't really do anything to it yesterday. I mean, I walked, but didn't do anything out of the normal. So I kind of gave it overnight Friday. I thought, oh, I'll go to my family doctor's walking clinic Saturday, get it checked out. Well, sure enough, it wasn't open because it was the long weekend, so I didn't really want to go to any other walking clinics to see any other doctors just because of this surgery. I wanted to see my family doctor. And so I thought, oh, I can tough it out till Monday. Well, even with icing it and applying heat to it, it got worse over the weekend. By Monday, it was in my big toe as well as my ankle on my right foot, and I could hardly walk on it. So basically, from last Friday till now, I've been basically sitting with my foot up, trying to keep weight off of it, icing it, keeping heat on it, trying to make it better. On Monday, I wasn't even able to see my family doctor. I had to go to his clinic's walk-in practice. And the doctor there basically said, yeah, I don't know what I can give you because NSAIDs, which are typically used to treat gout, cause major stomach issues for people with gastric sleeve, and NSAIDs are supposed to be a big no-no. So he said, I don't want to risk hurting your new stomach. I'm just going to give you Tylenol 3s to treat the pain for now until you can go see your surgeon. So I thought that was fine to see my surgeon Wednesday. I'd only have to wait 2 more days. So between Friday and Wednesday, basically, I was taking the hydromorphone that the hospital had sent me home with and T3s to help with the pain. They helped somewhat, but for the most part, it only took the edge off. It was still very painful and hard to walk, really hard to put my foot in a shoe, especially. I had to leave my shoe undone because my foot was so swollen. But other than that complication, there wasn't really much else. I stuck to my timeline of drinking my fluids every hour. So 1 hour the protein shake, next hour the sugar-free clear liquids. Slowly over the 2-week period, the sugar-free liquids, as directed, I was able to push up closer to a full cup rather than a half cup. And that's just where they want you to be, is I want you to try to be getting an hour of fluid, or sorry, a cup of fluids in each hour that you're not on the protein shake. And so yesterday afternoon I went and saw the dietitian and the surgeon. The dietitian thought everything looked like I was going really well. She said, "Oh, you're following it." She kind of asked a trick question in the appointment. She said, "Have you had any solid food since you've been home?" And I looked at her. "Well, no, we're not allowed to have solid food." And she goes, "Yeah, it's a trick question. I ask everybody that, and everybody looks at me like, oh, I could have." So I had a little laugh at that. But no, she said everything looked like it was going well, so I get to start on my stage 4 diet and all of my nutrition supplements, which I'll do a video for you guys later this week on what the stage 4 diet includes and what my nutrition supplements are now. My doctor didn't have me start on any of the nutrition supplements right after surgery. He just wanted to keep it very basic, what was going into my stomach. Didn't want to risk me trying to get too much in there because it is a lot to sort out. I saw the surgeon. Like I said, he looked at the and said, "Yeah, everything looks really good. There's no pain, so obviously everything's healing really well." He didn't even look at my foot for the gout. I just told him about that I had it, but they didn't treat it with anything because they weren't sure what to do for my stomach, and he agreed that that was a good decision by them. He gave me an anti-inflammatory, basically an NSAID, which he said, yes, we're not supposed to give you, but it's really the only very effective way to treat gout. So he gave me a very short course. It's actually 6 pills over 2 days. So he says it shouldn't harm your stomach too much because you're only on it for a very short time. So I started that last night and it's already feeling better. So hopefully it doesn't irritate my stomach too much. Other really exciting part was I asked him about my blood pressure and diabetes medications. My blood sugars have all been really good, in between 4 and 6. So he said, no, just keep off of the diabetes medications. We have to monitor my blood sugar still though, because as I change my diet, as I move through the stages, my food intake's going to change, so my blood sugars may change as well. So we just have to keep an eye on them. My blood pressure, I checked it a couple times at Shoppers Drug Mart in the 2 weeks that I was home, and it was in like the 130s to 140s over like mid 70s to mid 80s, which is a little bit on the high side. The surgeon thought, it's borderline. He's like, we're not going to put you back on the medication. We're just going to monitor it. He's like, as the weight comes off, that should lower. He said, obviously, if it doesn't get lower, then you're going to have to go back on something. But he seemed very hopeful that as I lose weight, that would for sure come down. He said, you're so close to the border of the high versus what they consider high versus low now. He said, there's no point in putting you back on the medication. So I'm still on the antacid every morning, just so I don't produce any acid in my stomach. Be on that probably for a few more months. And yeah, the NSAID for the gout, but that'll be done today. And I have T3s for pain for the gout until that's dealt with. And I guess the question that everybody's been asking and everybody wants to know, the official weight loss to this point is 43 pounds. So I'm pretty happy with that. It's a significant amount I lost on the pre-op diet and since surgery, but I'm just going to stick to doing the total weight loss numbers because that's all that really matters to me. So yeah, 43 pounds. I'm pretty happy with that. I get weighed in the middle of the day there, so when I checked myself in the morning at home, it was a little bit different than what it was by 2 o'clock at the doctor's office, but I'd rather stick with their numbers because their scale's going to be a little bit more accurate. So yeah, that's how everything's been going. Not too bad except for the gout. You know, hopefully I'll get an update for you guys on my stage 4 diet and the nutrition supplements I have to take later this week. Thanks. Bye.